Hi, everyone. Thank you so much for joining us for cross-sector collaboration for police-free schools. My name is Madison Hammett. I am a senior policy analyst with the Illinois ACEs Response Collaborative. I'm going to give folks about 30 seconds to log in and get settled, and then we're going to go ahead and get started. Okay, so we are gonna go ahead and get started. I'm gonna walk us through a couple of logistics items before I hand it over to our speakers. Oh, there we go. After the webinar, you are going to receive an email from me with the following. You're gonna get an evaluation survey. Tell us what you thought. You're gonna get ways to participate with us at the collaborative. You're going to get links to our website, which includes policy briefs, our other webinars, and also a blog we have recently posted on why we are supporting the No Cops in School movement. And then you'll also receive a recording of this presentation and a link and information about our upcoming webinars. If you have any questions during the webinar or want to know more, we encourage you to type those into the question box on the side of your screen there. We're going to be, oh, that one always likes to jump forward on me, apologies. We're going to be monitoring that throughout the webinar, and we'll have a Q&A session at the end of this presentation. We have some new folks joining us, so just a brief background about who we are. We are the Illinois ACEs Response Collaborative, and we are housed at Health and Medicine Policy Research Group in Chicago. The Health and Medicine, rather, works to promote social justice and challenge inequities in health and healthcare, and is an independent policy center that conducts research, educates, and collaborates with other groups to advance health equity. And as I said, the Illinois ACEs Response Collaborative is housed within Health and Medicine, and our mission is to catalyze a cross-sector movement to prevent trauma and promote thriving across the lifespan, and to place the impact of childhood experience on well-being at the forefront of the equity agenda in Illinois. And as part of that, we are presenting this webinar and hosting these amazing speakers today, because here at the Collaborative, we know that there is more to trauma and adversity than the 10 experiences covered in the original Adverse Childhood Experiences study from which we take our name. And we are committed to addressing not only the individual traumas, but also those created and perpetuated by the systems in which we live. As part of that commitment, we share the belief that Chicago students cannot thrive in learning environments that are policed and criminalized, and we join the call for the removal of police officers from CPS. If you would like to find out more about why we support police-free schools, including some of the statistical and researched information behind that, please check out the blog on the topic we wrote. I'm gonna drop a link in your chat box, and we'll also be including that in the follow-up items. And I'm gonna briefly go through our speakers' bios since I wanna get us started, but we are joined by 4 amazing speakers today. Doctors Meredith McNamara and Margaret Russell, and then 2 youth activists from VOYCE who are working on this and have joined together to come and bring this information to all of us. So Doctors McNamara and Russell are representing the medical side of things to let you know how they got started with this work. And then Dariana and Ruby will be talking about how they've coupled that with activism and how VOYCE in particular has played a role within their work. So I am actually going to turn it over now to Dr. Russell and give her control of the screen. And thank you so much, everyone. So you should now be able to share your screen with everyone.
Thank you. So thank you so much for that great introduction, for having us come to talk. Meredith and I got involved in this as physicians because we're very concerned about the health impacts that this has on our patients, particularly our youth patients, but also for me as a family physician, I see people throughout their lives, and so the trauma that they experience as children carries into their health as adults. So the things I'm going to be talking about today are the history and role of school resource officers. We're going to be debunking some of the misconceptions about school resource officers. We're going to discuss how they compromise safety and learning, particularly for students of color. We're going to talk about the role they play in criminalization of youth in the school to prison pipeline. Oh. And we're going to be also asking you to engage in an action supporting youth-led efforts to advocate for their removal from Chicago Public Schools. So just to quickly kind of explain what SROs are and their role, it stands for School Resource Officer. They're a police officer assigned to work in a school. Their roles are multiple in many cases. They are there for law enforcement, but in some cases they are also expected to teach. They are expected to act as informal counselors and mentors, as first responders, and sometimes as disciplinarians. But those roles are all pretty poorly defined. They vary a lot from school to school and from state to state. They also receive very little training and oversight to specific to their work in schools. So I'm sure you can imagine how that becomes problematic, especially when you think about being expected to be an informal counselor or mentor to students when they are also 90% of them sworn officers whose primary role is law enforcement, and therefore things that a student may tell them in confidence, perhaps assuming that it is confidential the way it would be talking to a formal counselor or a school therapist, may find that that gets them or other people into legal trouble. So just really briefly, the history of police in schools. So the very beginning of this really started around the time of the Great Migration and the integration of schools after Brown versus the Board of Education, where white communities were concerned about integration, were making accusations that bringing African American students into their schools were going to cause disruption. And so the very first iteration of this was the 1948 LA School Police Department that basically was put into place to patrol the newly integrated schools in LA County. In 1953, the very first SRO program was created in Flint, Michigan. The idea behind this program was that by having police officers in schools and having students interact with them, students would then have a more positive view of the police, and that it would create this kind of cooperation between schools and police. And then we get up to about 1974, and there starts to be in the media some overly exaggerated statements about youth violence and this idea that youth, particularly youth of color, are delinquents, that they're basically need to be managed through force. And so at this time, the SRO programs had started identifying and having teachers identify students that they refer to as pre-delinquent, which means students who hadn't really committed any crime or done anything wrong, but that maybe had some trouble with adjustment, maybe didn't listen or were disruptive in class. A lot of things that we now also would associate with possible learning disabilities became sort of pre-criminalized and allowed those children to be treated, interrogated and treated as criminals, even though they had not done anything wrong. In 1994, the Gun-Free Schools Act was passed that led to the first federal zero tolerance policy that really then triggered a need to have law enforcement involved in schools, because if you're going to say there's zero tolerance, then you need someone to enforce that, and increase surveillance in schools. That also led to, in 1998, an infusion of federal funds into providing surveillance equipment and also police officers, grants for police officers in schools. And then in 1999, we had the Columbine School Massacre, which really enhanced the amount of policing being done in schools. People became very afraid once they saw on video this violent act occurring in a school. And so there was a perception of a growing threat of juvenile violence, even though in reality, violence in schools was actually declining at that time and has continued to decline. And then in 2005, the school, there was an end to the Cops in Schools grant program, which meant that funding of the SRO programs was taken over by the schools and local governments. And at the time that it was ending, the Cops program put out a book with their recommendations, one of which was to maintain police officers in school at the expense of the schools and to cut the funding of other parts of the school budget, things like supplies and teachers and counselors, in order to do this. So one important thing that we do now have quite a bit of evidence about, one misconception is that policing makes schools safer, that the whole point of this is for school safety. But realistically, policing does not, in fact, make schools safer. This is one study that was done when the IMPACT program was implemented in New York City. The IMPACT program supplied additional officers, pretty much doubled the number of officers in certain schools in high crime areas, and also gave somewhere between $135,000 and $153,000 in grants to increase school security. And what was seen in that study was that there wasn't really a change in student behavior in those schools, but in comparing impact schools to similar comparison schools and then all non-impact schools, the rate of suspensions went up in the impact schools after implementing the program. The attendance rate went down. The rate of major crimes went down slightly, but it went down slightly also in the comparison schools. But the incidence of non-criminal police, incidents, so basically police being involved with students when no actual crime had been committed, went up pretty substantially. And I don't know if you guys can see, I'm moving the little box around. I don't know if you can see this. Make that go away. So there's also been a pretty comprehensive review of all of the evidence in the studies that have looked at the impact of SROs in schools. And this review also found that the things I've already mentioned, that school police officers have really conflicting roles, have a lot of authority, but aren't really prepared for those roles. Even the officers in these studies felt like they were not adequately prepared and trained for what they were expected to do. There wasn't really any significant change in, well, it's either no change or increases in exclusionary discipline, so things like suspensions and expulsions. And the presence of SPOs was associated with an overall null effect on safety, but an increase in student arrests. Okay, so we also have to think about the psychological safety of our patients. So we do find that the police presence in schools can be a stress-inducing visual stimulus for some students. The punitive policies that are being employed increase the likelihood of future disciplinary problems and student contact with the juvenile justice system. And increasing the police presence in schools also exacerbates students' feelings of lack of safety and distress, especially among Black and Latino students. And we all know, here we all know about the ACEs and the effect that those sorts of stresses chronically have on a person's mental and physical health throughout their lifetime. They also can be a threat to students' physical safety. There have been a lot of incidences of abuse of force, pepper spray, tasers, handcuffing as punishment, punching with a closed fist, pain for compliance techniques, hitting, kicking, and slamming and choking students. There have been some fairly prominent and newsworthy events, but these also there has also been less dramatic incidents that have occurred. And there have been cases where students have had one of these abusive force incidents with an officer and then have had to go back to the school where that officer works because the officer was not removed from the school and then has to see that officer every day. We also know that there is racial bias in the use of force. This is just a graph that shows the non-arrest handcuffing incidents of students in New York City schools in 2016. All of the incidents that were not mental health incidents were of Black and Latinx students, and all but 2% of students who were handcuffed during a mental health crisis were Black or Latinx. We also know that there are huge differences in the demographics of students who are arrested. So at Illinois schools, even though 50% of students are white, 17% are Black, and about 25% are Latinx, the number of students who get arrested, 44% are Black, and 41.3% are those who are referred to law enforcement are Black. So the number of students who are being subject to more aggressive policing tactics tend to be our Black and Latinx students. And I'm going to hand it over to Meredith to talk about misconceptions about police. Sorry, Meredith.
Oh, I'm unmuted now. Okay, great. Thank you. So over the course of as physicians, our short course of advocacy work to try to address getting cops out of schools with the Chicago Board of Education, we came across a couple misconceptions about school resource officers, which are pretty prominent in the kind of like higher level and also community level dialogue. People believe that SROs prevent school shootings. So we'll talk about evidence to the contrary. That SROs provide valuable mentorship and counseling to students as a whole. That students with dangerous behaviors are the ones who are targeted. And then also that school resource officers reduce dropout and improve school performance as well as college enrollment. You can go to the next one. So the school shooting issue is really interesting. School shootings really started to become more common as police entered schools. We know for sure that SROs do not impede active school shootings. So this was an FBI report of all active shooter events from 2003 to 13. Of these 25 events, absolutely none were ended by armed staff, guards, or police officers. Most were ended by unarmed staff. This is so tragic, but very famously, the security guard at Marjory Stoneman Douglas, who did not intervene in the active shooting event, was recently sentenced for criminal neglect. Next slide. We can go to the, okay, thanks. The other misconception is that SROs provide invaluable mentorship and teaching in the settings that they're assigned to. They actually, not shockingly, spend a majority of their time policing. So this is just self-report, work week time reports compiled by the National Institute of Justice. They spend about half of their time doing law enforcement activities in schools. Advising, mentoring, which they really don't receive training for, about 16%, teaching, like DARE programs, safety programs, about 12%. If a school resource officer or an aspiring one is able, they can attend a 3-day training, which is offered by the National Association of SROs, but that is not mandatory, that is optional. It's 3 days of training in community engagement, emotional and psychological well-being, adolescent development, However, this is recruitment of people who have spent their entire careers in law enforcement previously. So not surprisingly, you take people who have a strong law enforcement background and expect them to do other things, they will not. What's next? Also, and there is strong evidence that shows differential outcomes in education. So SROs are unfortunately associated with worse educational outcomes. These are two studies that we're quoting here. These were really good, huge studies that controlled for socioeconomic status and a bunch of other confounding factors. Of all public schools in Texas, schools with SROs had a 2.5% reduction in high school graduation and a 4% reduction in college enrollment. That we know is the independent effect of school resource officers. In New York City, it was evaluated, so standardized test scores were evaluated. And what was found was that specifically among Black male students exposed to SROs, that there was a decline in standardized test scores that was small but statistically significant, that appeared at age 13 to 15 and then persisted throughout high school. We also know that educational outcomes are worsened by more suspensions. You can't learn and participate in school if you're being suspended, and we know that suspensions are higher when school resource officers are involved. And learning in a climate of heightened fear, the threat of violence, that's very difficult to do. Go to the next one. So we also know that students with disabilities are more likely to be targeted by SROs. This is specifically in Chicago. So between 2003 and 2013, 85% of students in CPS did not have IEPs, 15% did. However, you can see that among those who were arrested or referred to law enforcement for any reason, about 30% had IEPs, whereas 70% did not. So Margaret had mentioned earlier that the criminalization of behaviors associated with learning disabilities, mental health problems, chronic trauma, this is being observed in real time with actual data. Go to the next slide. This is also really harrowing data that comes out of the Handcuffs and Hallways report from the Shriver Poverty Law Center. So complaints against school resource officers in Chicago public schools are extraordinarily high. 67% of all SROs have at least one claim against them. 31% have 3 or more claims, and 11% have 10 or more claims. Now, not all people who feel victimized or brutalized by a police officer issue a claim. And this doesn't really speak to the content of each one of these claims, but there is a pretty solid suspicion that these numbers might even be underreported. Next slide. So what Dariana and Ruby will discuss is what we should be spending our money on, but I first just want to make the point that these programs are extraordinarily expensive and represent a big black hole for taxpayer money. So Margaret mentioned that federal funding through the Cops in Schools grant ran out in the late 90s. That meant that local governments, state and county governments were going to have to fund these themselves. So it costs now about $100,000 per year to maintain a single SRO. Some other estimates that I read put that at about $140 per student per day. That could easily be an out-of-pocket therapy session. Chicago Public Schools actually increased payments to the SRO program during a huge fiscal crisis in 2013. They increased their payments to $13 million when they didn't have enough money to pay for counselors or school nurses, and continued their contract. And then this is really shocking data. Between 2012 and 2016, SROs in Chicago accumulated or cost the city a little bit more than $2 million in misconduct settlements. These settlements were for abuse of force. One girl was paid, and her family were paid $50,000 for being tased in the face, for broken bones associated with handcuff injuries. So these are very real things that are getting settled, and it's costing us a lot. We can go to the next slide. So I also just want to make the point before we hand things over that adolescent conduct is it's teenagers need to relate to their peers in a way that helps them develop a sense of identity and their social skills in life. A lot of these things that teenagers are getting reprimanded for and receiving criminal charges for are actually quite normal behavior. They're either totally benign or they're just kind of a reflection of development, building self-esteem, and the environment that they live in. So the criminal charge of disrupting a school environment, people have received charges for spraying perfume, burping, farting, disorderly conduct, cursing, refusing to leave a classroom, kicking a trash can. These are real criminal charges that stick with you. Assault, simple things like throwing a paper airplane, Skittles, snacks. Drug possession for carrying a maple leaf. Small larceny for throwing a milk carton. Felony forgery for using a counterfeit bill. And indecent exposure for wearing loose-fitting pants. We can go to the next slide. So all of this contributes to what we call the school to prison pipeline. Schools which enhance and facilitate exposure to policing are basically funneling students into the criminal justice system. So by criminalizing normal behavior, severe punishments for minor infractions, zero tolerance policies without trauma-informed guidance, broken windows policing. What's happening is young people are being arrested, they have to be adjudicated and present within the criminal justice system. They receive heavy fines that they cannot pay, that they never should have been assessed in the first place. They might also just be learning poorly in these types of environments where they're afraid or constantly confronted by people who threaten and assault them. Missed days of school, either because of school avoidance or suspensions, disengaging in school, which happens kind of in the middle of high school. That's where the phenomenon seems to be noted. Dropouts. So there's a lot of data that shows that your chances of dropping out of school increase exponentially with each out of school suspension. All of these interactions with the criminal justice system make it really difficult to thrive in young adulthood. So if you can't get an ID, you can't get a job, you can't enroll in college if you have a record, even if that record is based on a charge that never should have happened. You can't join the military. So what ends up happening is that the school bus that takes kids to school ends up taking them to jail. We can go to the next slide. Okay, so we'll hand it over now to Dariana and Ruby.
Hello. Do y'all have the slides, or was it going to be? Because I sent it last night.
Hi, hi, this is Madison. I can either present the slides for you, and you can just tell me next slide, or we can share your screen.
You could do it.
Okay, that's fine. Give me just 1 second. I'll get it up for us.
Thank you.
No problem. Hey, can y'all see your first slide?
Yes.
Yeah. Okay, great. You just tell me when to go next.
Okay, you can go next. Dariana, do you want to introduce yourself?
Yeah, my name is Dariana. I'm a voice leader, and my pronouns are she, her, hers.
We're having some audio problems. Is someone on their phone?
Baby, are you there?
Is that Ruby?
No, I think
Okay.
it's Dariana.
Okay.
Okay.
All right. It's all good now, though. Okay.
Okay, cool. You can go on to the next slide.
The agenda today is going to be introductions, then which we just did, and who is VOYCE, and what is the Rethinking Safety campaign, and what are we doing now? You can go on to the next slide. The purpose of this is to get to know VOYCE, why we do what we do, and how we do it, and the second purpose is to build relationships. So we're just these are some community agreements that we usually do. The 3 R's: respect yourself, respect others, and respect the space. One mic means if one person is talking, listen. Take the lessons, leave the story. So that means if someone shares something, you could take the lessons, but don't go out and tell their stories like word for word. And land the plane means to get to the point. Be a croissant and not a donut means to be open-minded like a croissant and not closed-minded like a donut is. Demand clarity. So if you don't understand something, ask for clarity. Speak from the I, so you don't tell other people's stories. You speak from your own personal experience. And consensus is usually a thumbs up means you agree, a thumbs down means you disagree, and open palm means you're just going with the flow of the group. What is Voices of Youth in Chicago Education? Youth Lead Alliance, Young People of Color, Ending the School to Prison Pipeline, statewide legislation, trauma-informed leadership development, participatory action research, and youth-led alliance. Roles of young people in voice. Everything. Identify the issue that affects us, develop our own solution and design campaigns, organize youth meetings to talk about strategy on our campaign, build alliances, educate policymakers and general public on campaign and solutions, make final decisions on campaign and organize structure, interview youth, intern, and other positions when needed. In order to do this all, we also teach other the skills we need to achieve our goals. But we also branch out and teach other young people outside of VOYCE on how to engage the youth and people in the work we do, just like today.
The role of the adult allies in VOYCE is kind of like a backseat because VOYCE is all about putting young people in the forefront because they are the ones that are most impacted, especially young people of color. So when it comes to the adult allies for VOYCE, we usually ask that they only give feedback for campaign strategies, provide space, food, transportation, help fundraise, help speak to policymakers and general public, and help with research. So we kind of have like a hands-off policy when it comes to adults because of the way that adultism basically works in society, and the fact that as young people, we're always discredited and discarded when it comes to our own personal experiences when experience something traumatic within our school system. So next slide. So the wish list, this is basically how VOYCE was started. So it was a group of 10 young people that came together to design what they wanted their schools in Illinois to look like, which happened in 2012. And the three things that we basically wanted were data transparency, because no one ever believes us. Data transparency, meaning like all of the data on school-based arrests and any type of data that's basically incriminating CPD in our schools. We don't have a lot of data, and every time we go to Springfield to try to get data transparency, we're always met with well, I guess like false data themselves. The second thing is ending zero tolerance, because we should not be getting suspended or expelled for small things, which we actually have had a victory on for SB 100. It's a bill that VOYCE was able to lobby and get passed for the state of Illinois, which basically means that schools can no longer have policies that are zero tolerance, which basically just means if you do this, you will definitely get this punishment. And well, this is just we disagree with this because it doesn't allow for the schools to really think about what it was that the student did and set the punishments accordingly. And then the last and arguably most important thing is ending school-based arrests, because schools should not be a pipeline to prison. Here's in 2013 we passed SB 2793 for data transparency, but it wasn't the full thing that we wanted, because when it comes to Springfield, they change your bill along the way. That's just the way that it works, and we didn't get everything that we necessarily wanted, so that work continues. But in 2015, that's when we passed SB 100, which was that piece on ending zero tolerance policies within our schools. And that one actually is also including charter schools, so not just like regular public schools. And now what we're working on is the Rethinking Safety campaign, which you can go to the next slide. Our Rethinking Safety campaign basically is the idea that like we have this idea of what safety means that was fed to us by the media, by popular culture, and basically white culture, that really tells people in society like, what is it that's keeping you safe? Oh, it's the police. The police are keeping us safe. VOYCE is basically, with this campaign, challenging what it means to be safe. Let's rethink what it means to be safe, and actually listen to the young people that are being affected by the kind of violence in our schools that is debilitating, and get to the root causes and really think, what is it that's actually going to keep the young people safe? And to us, that's mental and behavioral health services, because that's where the root causes usually lie. So you can go to the next slide. Our solution has been many things, but the main thing was we were in Springfield last session working on a bill to try to get more mental and behavioral health services within our schools by reallocating money that is spent on SROs into these services. And we have all of these alliances that have been working with us. These are our adult allies, I feel, because we also work with other youth organizations in Chicago, but these are just our adult allies who have been helping us along the way, by advocating for the same thing. You can go to the next slide, Ariana.
Yeah, I had to repeat myself. Reinvesting from school resource officers to mental and behavior health. We have a citywide audience. ordinance. The ordinance will force the Chicago Police Department, CPD, to end the $33 million contract with Chicago Public School. We are working to have the Chicago Board Education to end the contract with CPD for that money to go back to those schools so they can use it for trauma-informed evidence-based approaches such as nurses, psychologists, and restorative, I can't say that, restorative activate, just practice counselors and more. We are launching a statewide bill during the veto session to call for reinvestments from SROs to mental and behavioral health programs. Questions and answers. Any questions?
Yep, that was basically it.
Thank you so much, both of you. That was great. And this is actually the perfect slide. We'll just leave it on this. So Laura sent out a chat to everyone to send in your questions. And I know we have a couple coming in. So let me pull some of those up. But just to get us started, and this can be for any of our panelists, can you tell us more about what actions do you think adults should do as individuals to support youth in removing police from schools? Not just organizations, but like say a parent or an older brother or sister, what can they do to support this work?
I'm a student from CPS and I go through these things on a daily, to really just to listen to us because, I understand as a parent, like, one parent by itself isn't enough really to change it all, but all of us together can make a good impact. So just to listen to us, because right now I feel like we aren't really being heard. It's like we're talking, but no one's really listening. Everyone's saying they're listening, but no one's really listening. And everyone's always saying like, oh, well, what can we do? But like I feel like no one's really trying. So try, like listening and coming together as a group to change something like this.
I just want to echo what Dariana had said, because I feel a lot of the times that parents don't do the work to educate themselves because like it's been a while since y'all have been in school and times have changed and things are dangerous for students a lot of the times in our schools, and parents don't see that. So what we'll have is a lot of parents who are advocating for police in schools instead of, educating themselves on the negative impacts of having SROs in our schools. So like Dariana said, the first thing is to listen to what we're saying, listen to what the evidence is showing, listen to the experts, and then get behind young people who are leading these movements. Yeah, like get behind. Don't. Because I feel like, especially with everything that's happening, a lot of folks feel compelled and are activated to do something. But instead of getting behind an organization that, has been doing this work for a long time and knows exactly what they're demanding and have, community members who are leaders within these organizations, they try to do their own thing. And that's just, funneling people into different rallies and events that could be more impactful had they just gone to an event or something led by young people.
Mm-hmm.
So I guess just being more intentional with where you're spending your time and listening.
Yes. Thank you both so much. That was such a great answer. So a question for Doctors Russell and McNamara. Can you talk a little bit more about, on somewhat relatedly, engaging health professionals with this work? What sort of activism or advocacy can folks do with the research behind them and the practicing behind them?
Well, I guess we have had allies who have come to our events and have spoken, using the data that they have collected and or know about the issues that we're working on. So if you're a practitioner and you want to get involved, there's many ways because your expertise is needed. Because it's sad to say, but they don't listen to us unless we have evidence, which is why we do it. Which is why when we have press conferences, we have young people, but we also have, psychologists, nurses, social workers who come and speak on their experiences, to basically explain why what we're saying is true. So if you're a practitioner, there's several ways to get involved, but making yourself available to organizations that may need your expertise when it comes to press conferences or other gatherings in which we are required to speak on the subject.
Thank you. And then so if I can piggyback that off, for our doctors who presented today, like what work can folks do within their organizations, or how have y'all collaborated within your hospitals or with other health practitioners to do what Ruby is saying and listen to young people and support them?
So that's a little bit of a hard question to answer, because I think personally I'm still working on figuring out the best way to do that. But I think that we all, as physicians, we need to be listening to our patients. We need to be asking young people the right questions, and then we need to be, we can't just sort of document these things in the chart and let it go. We need to be speaking on what we're seeing, and because unfortunately it is true that people are more likely to listen to us than to youth activists when it comes to certain things. And I think that we can support them by validating what they're saying and by sharing the evidence and our own experiences.
And just to kind of add to that as well, so social media has made this really, really feasible. You can kind of like follow certain tags and connect with certain organizations. I think without Twitter, I never would have connected with anyone on this in this session. What you have to do is kind of be abreast of what your Board of Education is doing right then and right now. So here in Chicago, for instance, we followed the Board of Ed vote to end the SRO contract and found ways to speak at their meetings. And when we spoke as physicians, we basically echoed things that youth advocacy groups like VOYCE and Cops Out of CPS have been saying for years. We took their data and we credited them and presented it to Board of Ed members. The other thing that we found that was really important was kind of like an evidence-based medicine, science-based approach. So finding out what misconceptions were and debunking them with actual data. What we're doing right now, what we're trying to do is reach out to individual local school councils and email people on those councils. All of this is public record. You have to do a little bit of digging, but Twitter is incredibly helpful. And because that's where the decision rests with SROs in Chicago right now, and we're just kind of providing the data that we've compiled and elevating the youth organizations that have been doing this stuff for years.
Thank you so much. So I have two questions that I'm gonna combine for Ruby and Dariana. So we have someone from CTU is organizing a march on August 3rd that aligns with No SROs. How can we reach out and have a voice and presence there? And then we have another person who would like to know how they can work with VOYCE to be an adult ally, so who they should reach out to about that.
That would be Maria DeHelio. So And yeah, for both questions because
Okay, great. I will put Maria's name in our follow-up for those of you who are interested in working with VOYCE and having them attend your events or learning more about that from them. So I will make sure that folks get that. So we have another question that is about data. So what data would be the most helpful to have support getting police out of schools?
we
Oh, go ahead, I'm sorry.
wait, anybody?
Yeah,
Or-
anybody, please, yes.
Okay. The data that we were looking to have when creating the bills for the statewide legislation is basically racial analysis of school-based arrests. That's really important. Gender analysis of school-based arrests. That would be most helpful because then it really will put a magnifying lens on the disparities that exists when it comes to students being arrested, and it'll basically show like the disparities between young people of color and white students. This is really important in order to move forward with removing police from schools in the first place because they need evidence to. I mean, it's kind of hard because they don't even listen to the evidence either. But
I was going to say that that's our limited experience as well. There
But yeah.
is so much evidence out there to back up how harmful police and schools are.
Yeah.
I don't know if it's a shortage of evidence being the problem.
Is there a particular piece of evidence that you have seen be more effective than others, or is it just a bit all over the place with that, or not effective regardless?
I'm not that it's not effective, just that like it really depends who's in the room. It depends on what you're trying to achieve and who's willing to listen. Because if you're talking to an elected official that is open, you're obviously going to get better results than if you get an elected official who is very stubborn and doesn't care about evidence or anything.
And then we have another question about how can parents and community members work with local school councils or PTAs to help remove SROs from schools? So what role can those organizations within the schools play?
So the way an LSC works, like I'm not sure if people are familiar with it, but if you're a community member or you have a student who is in CPS, you're allowed, like you have the right to attend LSC meetings. So the first thing is figuring out when the monthly meetings are. And if you really want to remove SROs from schools, you need to organize a group of parents and maybe some students who are willing to, sit up there and demand that SROs be removed from the schools. That's how other schools have been doing it. That would be, but obviously this is like a temporary fix because you're just doing one school compared to like reinvesting all of this money into mental and behavioral health services for the city and for the state. But it is a start. So yeah.
And then we have, oh, I'm so sorry. Please go ahead.
Okay, I was just gonna say, yeah, that the decision that's been made here in Chicago is that by the Board of Education is that each school has to decide, and so really paying attention to when those meetings are and speaking with your individual school is such an important thing right now. Especially if you're a parent, making sure that your voice is heard by your school.
And then we have two more requests for getting involved, so I'll join them together. One for our doctors. So what is a way that doctors and other hospital professionals can bring this information or get more people involved in this work? And then for our VOYCE folks, we have a recent CPS high school graduate, congratulations, who wants to know if she can also join VOYCE and work with y'all.
Definitely. Nice to meet you, whoever you are. Yeah, you can definitely join VOYCE. It's really just about showing up to our events, and then we'll consider you a voice, I guess, leader.
Great. Well, great. And like we have said a couple of times in the chat, we will be sending out contact info in our follow-up email. So if you are interested, please reach out to the folks at VOYCE. And then for our doctors, what can hospitalists do to get this out in their organizations?
So I think you can pay attention to whatever your institution is doing to respond to this national dialogue. A lot of people have put out statements, but holding your institution accountable to whatever action items they've developed or asking them to add this to their action items is one thing. You can see if your institution is willing to make a statement on this issue. Ask them what their affiliation with Chicago Public Schools are or is. As of right now, I personally have not tied my institution to this because they have not decided whether or not they want to put out a real platform on police and schools. But you can always give us a shout, and we'd be happy to fold you into our crew. And basically, we just pay attention to what's going on, and we try to speak at meetings. We try to contact school board officials, and we try to connect with youth advocacy groups and ask what we can do.
Well, I see we still have some questions in, but I do want to be respectful of our speakers' times. So any questions that you still have, I am happy to pass along to them. And I also see that we have in our questions several shout outs to our VOYCE youth activists, in particular, thanking you for your work, and to both of our doctors as well. So thank you to all of you for your presentation and for your time. We really appreciate this and the important work that y'all are doing. Thank you so much.
Just one quick thing I want to say about physician-led advocacy.
Yeah, of course.
I always thought that it was going to be kind of arduous and hard and time consuming, and I didn't even know how to get started. It turns out you just do it. Like, you know, you do it, you ask questions on whether or not you're doing it right. You look and see what other people are doing. You try to amplify voices and fill in the gaps with your expertise. And it's really not that hard. So if anyone is feeling a little bit overwhelmed or kind of tired by the state of things, especially in their daily practice, feel free to send us an email. And, it can just kind of be like part of your weekly routine. You contact the local school council, you reach out to a friend who's like-minded, and you guys do something together. Anyway, thank you guys so much.
Thank you.
Thank you so much for having us.
Thank you. And everyone who's attended, you will receive a follow-up email with contact information, copies of what you've seen today, and as well as a recording. So please feel free to reach out to me if there's any other questions or items you have for our speakers, and I'm happy to pass those along. Thank you again to all of our wonderful panel, and have a wonderful day.
Thank you, guys. And thank you, Dariana and Ruby.
Yes.